What is up, beautiful people? Welcome back to Nursing Basics. So in the last video I posted, we talked about first degree AV blocks. In this video, you're going to learn about second degree heart blocks, and you're going to learn about both of them, type 1 and type 2. Let's do this. Don't mind the roses, those are just something I got from my wife. Happy wife, happy life, right? Anyways, so we learned in the previous video that with AV blocks, electrical impulses from the atria, oh, where's my big heart? So, yeah, we learned in the first video that with AV blocks, electrical impulses from the atria, the upper chambers, don't always make it down to the ventricles, the bottom chambers. Ooh. Yeah, they're either partially or completely blocked depending on what degree of heart block you're in, first, second, or third. So there are two subtypes of second degree heart block. There is type 1 and 2, that's what they're most commonly known as. They're also known as Mobitz 1 and Mobitz 2, and type 1 is also referred to as Wanky Buck. Yeah, it's probably just the person that discovered it. I sure as hell didn't name it. So here's how we're gonna break it down. We're gonna talk about the basics, such as the rate, rhythm, PR interval, QRS complex, QT, all that stuff for both of them, just basic stuff. And then we're going to pop up an ECG on the screen so you can see what they look like and so I can talk you through what they look like, all right? So here we go. We're gonna start with second degree type 1. Let's talk about the rate. The rate for a second degree type 1 block is usually normal. And remember, what's normal? 60 to 100 beats per minute. So the rhythm, it's usually irregular due to dropped beats. And don't worry, I'll touch up on this more in a second. The P wave, there are usually more P waves than QRS complexes. And I'll touch up on this in a second too. And then the PR interval, it progressively lengthens until an atrial impulse is blocked completely in the AV node. And then after that blocked atrial impulse, the QRS complex obviously doesn't fire off and you won't see it on an ECG. So that's why the rhythm is irregular, because if your PR interval is getting longer and longer and then you just drop a QRS complex, then that means all throughout that ECG, the R to R interval is not going to be regular. Therefore, you're not going to have a regular rhythm. And the P waves, the reason you're going to have more P waves than QRS complexes is because if you have a P wave and then the QRS complex drops, then that means before the next QRS complex, there has to be another atrial depolarization, which represents the P wave. So you're going to have more P waves than QRS complexes. Now we've mentioned a lot about the QRS complex. So how is the QRS complex affected during the second degree heart block type 1? When it does occur, it's usually normal in shape and duration. It's not really affected. Same with the QT interval. Whenever there is a QRS complex, the QT interval is usually normal and unaffected. All right, so that was type 1. Let's talk about type 2, starting with the rate. So the rate is usually variable. I have personally never seen this in my nursing practice yet, but I also haven't been a nurse for too long. It's only been like, what, 6 months? The rhythm, the R to R interval, it can be regular or irregular. And then the P wave, there are more P waves than QRS complexes. Surprise! And then the PR interval, the conducted beats have a constant PR interval. So remember, in type 1, second degree type 1, the PR interval constantly lengthens and lengthens until a QRS complex is dropped. And then in second degree type 2, for every QRS complex you have, the PR interval is constant. So that means you will always have a P wave followed by a QRS complex, and that interval, the P and the R, is going to be constant. So you will have a constant PR for every QRS that occurs on the EKG. All right, so that's the PR interval. What about the QRS complex? It's usually normal in shape and duration, so it's not really affected. And same with the QT interval whenever there is a QRS complex. So those are the basics on them. We're going to pull up a picture of these two on the screen right now. That way you can get a visual understanding and then I can talk you through them as well. All right, so in this picture, there are 3 types of heart block. We will start with the top picture. This is a second degree heart block type 1. You can also see it up there on the title. If you look at the PR interval, it is getting longer and longer until boom, it finally drops a QRS complex. So if you count the P waves from left to right, you will notice that after the fourth P wave, there is no QRS complex, which means there is no ventricular contraction happening because that atrial impulse was completely blocked in the AV node and did not make it down to the ventricles. Yes, the heart really did just skip a beat. Now, the middle picture. This is a second degree type 2 heart block. The way you can tell is again by looking at the P waves and PR interval. If you notice, there is a P wave for every QRS complex that occurs, and every single one of those has a constant PR interval. So whenever there's a QRS complex, it will have a P wave that precedes it, and it has a constant PR interval. So if you count the fourth P wave from left to right, you will see that there is a missing QRS complex, and that's where the beat was dropped in second degree type 2. The PR interval does not become longer like in type 1, just to reiterate that. It is constant in type 2. So the third picture, I know it says 2 to 1 there. I'll give you a hint. It's either type 1 or type 2 heart block, second degree type 1 or type 2 heart block. So pause the video to see if you can figure it out before I tell you. If you guessed second degree heart block type 1, you would be incorrect. This is actually a second degree heart block type 2. Let's break it down and let's look at it together. Look at the P waves. There is a P wave for every QRS complex, and that PR interval for every QRS complex is constant. The only reason this is called a 2 to 1 block is because there are 2 P waves for each QRS complex. So just remember to look at that PR interval. That's personally how I like to differentiate between type 1 and type 2. That's what helps me out the most. If you want to take a second to look at these some more, pause the video because we're going to move on to a quick little summary. If I had to summarize the main difference between type 1 and type 2, here's what I'd say. Type 1, it has a PR interval that gets longer and longer until boom, a QRS complex is dropped. AKA the electrical signals get slower and slower until your heart skips a beat. So type 2, it has a constant PR interval for every QRS complex that occurs. There is no lengthening of the PR interval with second degree type 2. Both type 1 and type 2 have a constant P to P interval, which means from one P wave to the next P wave, it should be the same throughout. And both type 1 and 2 have more P waves than QRS complexes. Well, there you go, peeps. That's the basics on second degree heart block type 1 and 2. I hope it helped you out. Please don't forget the basics of life. Be kind and do good. Peace out, guys. Bye.